Awesome. Thank you guys both so much for joining us. Dr. Natasha?
Hi.
See you.
Nice. Thank you. Thank you so much for having me.
Of course. Thank you guys so much. So I thought maybe we can dive in with the question that I know is on my mind. And as I talk to my friends who are also moms working or, working at a job or, in the home, with everything, and that's what we're all doing now, right? We're wearing multiple hats. With everything going on, can you guys just give us some real talk about how can we protect our families? What is I know that's a big question, but what are some of the things that, if each of you can share some of the things that are your guiding principles during this time as you are, you both navigate career and family during a crisis that is unprecedented. What is the game plan, really?
Okay, I can go first. So this is a very stressful time. So I think it's hard on everyone. And with stress, we see, an increase of mental illness. That's a concern. But also stress is really hard on our immune system. It's hard on our gut health, which is the basis of our immune system. So I think focusing on things we can do to reduce stress for not only the parents, because we're feeling the stress and our kids can tell when we're stressed. They're very intuitive. So we have to make sure that we're taking care of ourselves and taking care of them. So, working on breath work or yoga or meditation or some self-care, take turns with a spouse, or if you're a single mom, get some help and maybe have the kids somewhere so you can work on your mental health. That being said is, what we put in our bodies, make sure our nutrition is really on par right now. It's okay to have treats, but try to eliminate the sugar, lots of sugar for the kids so we can keep our immune system healthy.
Thank you.
Yeah, and for me as a general pediatrician, and my husband is as an ICU doctor, we have to take specific steps to protect our family, like, deconning in the garage, not bringing it in. I had, 2 COVID positive patients just the other day. So there's that added stress for, I get questions and text messages from moms whose husbands are delivery drivers or EMS and things like that. So just kind of figuring out what works for your family, especially if you're at an increased risk for exposure. Really, in terms of the childcare and how it's very difficult. We're all wearing a lot of hats and we feel like we have to entertain our children all the time. I'm here to tell you, as a mom of 3, we don't have to entertain our children 24/7. I think this added burden of homeschool, I think there's other things that can be done, because as most of us know, what they're doing during school time is actually done in a much shorter time. So I think really kind of figuring out what works for your family in terms of, different activities that the kids can do at home, having quiet time, continuing that they're, for instance, reading. And I feel like a lot of moms feel like that they have to be on call all the time with their kids. And again, kind of talking, piggybacking on what Jen said, that's really not doable, and that can affect mental health. Kind of concrete things that you can take is, really, again, doing your part to maintain social distancing. I mean, we get questions all the time about, when can I start play dates? And I have 3 teenagers, sleepovers and things like that, and just being really smart. And the reasons why we have these restrictions in place is not to punish anyone, is because we know that this works. And again, kind of figuring out what that looks like in terms of for your family, like, if you have someone coming in to help with childcare and those precautions and things like that, but things that you can do that will be helpful. And I just want to make a plug that, there is a lot of concern about coming to see your pediatrician, but all across the country, and including in my state in Virginia, we're seeing a drop in vaccination rates. And that is something that we do not want to see. So really, any concerns, just having parents call their pediatricians, because it's not just about the well checks and the immunizations, but again, kind of talking about what Jen just mentioned, we're also picking up kids with increased anxiety, increased depression, and things like that. So that's why it's always important to continue to see your pediatrician and call them with any concerns.
That's a great point. Thank you so much, both Dr. Jen and Dr. Natasha. So can you maybe walk us through what some of the, and I realize that this is changing um, pretty much daily. Sometimes it feels like we get new information. And I know for me that that kind of contributes to some of the confusion and anxiety. But what do we know about the way that COVID-19 affects children? And so in terms of symptoms and risks, and how can we protect our children from that while also doing the things that you said? So, we don't want to live in a bubble for the most of us can't, frankly. But, how do we reconcile the real medical risks with their needs and our needs as a family?
Well, I think the main thing that we're seeing now that's been coming out in the literature is the inflammatory disease in children, and as others have said, it's not that common, thankfully, but we are seeing it. So different symptoms, to look for. Again, if there's any concerns of high fever, and obviously the other findings of rash and not eating as well and other symptoms, obviously call your pediatrician. But I think what the main thing about COVID in kids is that they're asymptomatic carriers, and most of the time they're asymptomatic. So kids can get COVID and they won't have symptoms. And I think that's where the difficulty is because if they're around grandparents and other people that are high risk, we don't know how much they're spreading and what they're spreading.
Yeah, so working in the ER, yeah, definitely, we're seeing these new cases of these children that are having a Kawasaki-like illness. And Kawasaki's disease is something that's been around forever. I mean, that's the board question. That's what you have to know. It's a non-miss. When you have this fever for a prolonged time, then you get these weird rash symptoms. The whites of the eyes can be red, the tongue looks different. And then we worry about inflammation affecting our heart vessels. So then you get an echocardiogram and they check things out. But what this is when I put down my ER hat and I put on my integrative medicine hat, this is an imbalance of our immune function, our immune system, in inflammatory processes, autoimmune diseases. I mean, this is where preventative medicine really comes in. And with that, with children, this is making sure they're getting good nutrients, good supplements, have them take a multivitamin, because unfortunately the broccoli that we eat today isn't the broccoli we ate 15 years ago. It doesn't have the minerals in it because our soil is not as rich in minerals because we don't crop rotate and all of that. So, you want to make sure your kids are getting the cofactors they need to support a healthy immune system and healthy methylation cycle. We're exposed to toxins, and now my concern is that we are cleaning everything. Like, I'm in the ER right now and there's someone just cleaning constantly, and I'm like breathing in the fumes, and I'm like, I have to go home and take more supplements. But we have to look at that too, because our kids are supposed to play in dirt. They're supposed to be exposed to germs. It helps them. One reason why they've looked at it, some papers, why they thought kids weren't getting hit as hard with COVID-19 or SARS-2 is because they were probably exposed to a similar coronavirus, because this is just a coronavirus. It's just a little different and mutated. And that has built them up some immunity to it. So when their immune system sees it, they're like, okay, we're good. I'm not going to chill out. I'm not going to put all these cytokines out there and cause a cytokine storm, which is really what is ending up people, on the ventilators in hospitals, this overactive immune response, similar to H1N1. So, I think as a parent, and what I try to, teach on, my Instagram handle, and what I try to tell to friends is that, as parents, we're always going to worry about our kids. So what can we do? Okay. And that is make sure they're getting proper, supplements, make sure they're getting their vitamin C, their probiotics, make sure that you're building up a healthy little warrior against, a virus, and their immune system safe. And yes, if that means, going to well checks, making sure they're growing properly, make sure there's nothing else going on. I definitely agree with Dr. Natasha that, you make sure that you're just not, following up with your doctor and making sure they're safe. So I think as parents, we're getting anxiety too over this, because these are our kids. Like, we don't want them to be that one that gets the rash and the Kawasaki's and ends up in the hospital. So just really focus on, the preventative and what you can do, because we can do so much at home. We really can.
Forgot to unmute myself there. Thank you so much, both of you, for that input. And that actually raises a question that a little bit different than what we had been talking about, which is we have, I live right outside of New York City, where we are continuing to have in the town where I live, actually today, we just learned that our number of diagnosed COVID patients has gone up. And it is really challenging to manage the various competing needs that we've just talked about. So, I work and I have a responsibility to my professional, life. Also, obviously, the responsibility of bills at home and all of that sort of thing, and my children. I want to keep them safe, and I'm worried about their mental health and their, how they're coping through this time. And, Dr. Natasha, my son has asthma, so we did his checkup via Zoom, which was a great experience during the first month of this. And surreal as it was, I feel like it was very helpful, and I have a great relationship with our pulmonologist. But now that we are here going on 80 days of this, and it seems like there is still some news to be, there's still some issue that we have to navigate, and it's really balancing. We brought our nanny back as safely as we could, but we rely on things like school, a nanny, my parents who are not elderly, but they're not young, to help take care of our kids. And, the play dates and all of these things are crucial to, I think, my kids' well-being. So when you have all of those things swirling, is there a way that, is there something that we should be looking for that can help us make these decisions even on a day-to-day basis? So I'll give you an example. I would love to start having more play dates for my kids because, they enjoy that, and we can go outside now, and it seems like a pretty safe proposition. But is it, if my nanny is with them and some of their friends in the neighborhood, how much more greatly are we expanding our bubble, and what risk are we then creating for ourselves and other people that we don't quite understand?
Right. So I think if you look at the studies from China on how this has been transmitted, and the great rates of transmission were dinner parties, were people that when they were in China, these studies I've read, that there was a high rate of transmitting the virus in these tight, dinner parties of 8 or 10 people with families, because they're inside, a small room, and they're breathing on each other, and they're doing all this. So is it risky, to have a family over, eat dinner? I mean, yeah, if someone's an asymptomatic carrier or they're not having symptoms, it's risky. Here's what we have to realize about COVID-19. It's not like the flu. You get the flu and bang, you feel like crap and you're in your bed. You're not going to a dinner party. But COVID-19, you have this long period, it could be up to 8 days, where you feel good. You're like, nothing's going on. So that's the big difference. That's why this is so weird, because it's different. But it is like the flu in the fact that, good hand washing, we have to, we have to do our normal precautions. So it is such a balance. I'm happy things are starting to open up, because we are flattening the curve. And someone actually told me this great analogy today. It's like a balloon, okay? So you have a balloon, we're just flattening it. The volume stays the same, okay? So we're saving lives in the fact by staying home is that we're mitigating, because we are making sure our hospital capacity can handle a surge of, but now it's time to start to open up. There's still going to be new cases. There's still going to be deaths, because this is a pandemic and it's a crazy virus, and we're still learning how to treat it. So I know that doesn't fully answer your questions, but you just have to realize there is some risk. And what you can do is, take your zinc, take quercetin, which is a zinc ionophore. You can take stuff that if the virus comes in your body, you're like, nope, see you later, or you're going to just, handle it. But there's always going to be risk. And, it's just like there was risks for getting the flu, because people would die of flu, and children die of flu. I mean, they still do. So I'm sure Dr. Natasha has something to say too.
And just piggyback, this, I was getting these questions, 2 months ago, like, my kid, they want to go outside and things like that. And I think it's social responsibility. Like, an individual action has a community impact. I mean, it's not just about us. It's not just about, what we're all sacrificing. My daughter lost prom and graduation. I don't get to see my firstborn get her, high school degree, and I think we have to change the conversation, and that this is, that this is unnecessary. And as Jen already said, we have been successful flattening the curve. I mean, not in New York, unfortunately, where we did run out of resources, and that that was horrific. I mean, I trained in New York City, I trained in Brooklyn, I have family there, and we were seeing it every day. They were calling us, they were telling us what was happening. So we have been successful, but I think we have to do it smartly. For play dates and things like that, let them have their friends over. Maybe they can ride bikes. Obviously you don't want a group of them to cluster in your house and, have that sleepover. Cause again, as we've said, there is that risk, because again, you don't know who they've been around, who your family's been around. And I think everyone has to be aware of those risks. Everyone knows what my husband and I do for a living. So, before our nanny comes back, it was really up to her, because, my fear as a medical professional, and my husband who takes care of these patients in his COVID unit, like, we're probably more risky giving it to someone. So again, just being really cognizant of that, because, we have family members who are, on oxygen, have tracheostomies and things like that. So just being aware of that. And then I think, again, teaching your kids, it's just like, sneezing into your sleeve or coughing into your hand. It's all common courtesy. It's what we've all, been doing. We all teach our kids, like, even if you have just the common cold, you're not going to just have them, sneeze, and good hand washing and things like that. So, if you have the play date, maybe you keep it outside, maybe you, they're riding bikes, or they're walking together, or they're, going to be spread out, across the yard and things like that. And I think just weighing the risk and benefit ratio. But I think everyone has to be on the same page. I think every parent has to feel comfortable. And for those parents who are not comfortable, then it's okay. And not that anyone feels bad. I mean, we have some parents who are really, really protective, and some parents who are like, let's just open it all up. And I think finding that medium has been challenging.
Thank you very much. It seems like a lot of what we're hearing is you have to take the information and be really diligent about pursuing, getting the information and making the best decision with that information that you possibly can, and being kind to yourself and being kind to other people who maybe make different decisions, so that we don't have the dynamic where people are feeling judged, overly judged, as they navigate these times. So Blessing just let us know we have about 4 minutes left. And in that time, I'd love to quickly sort of tackle 2 quick questions, if you don't mind. Going back to work, how can businesses do so, take care of the employees that they have and welcome them back with a minimal risk? Is that possible?
Oh, I definitely think it's possible. What I have found interesting, obviously not in my field, but what I have found very interesting, and as someone who juggled nannies and babysitters and daycare in New York City, like yourself, the system is really set up against working moms, if you really look at it. And what I have found really fascinating, and I hope what comes out of this is that people are going to have more options to telework, in terms of access. Just looking like you and I, Andrea, in New York, like the time it takes to get to work, the expense, the commute. Can we telework? Can a lot of people, instead of going to the office 5 days a week, can they do it 2 days a week? And I find it fascinating that everyone I've spoken to has been working from home. They can get the same amount done in a very short time. I mean, can you imagine how it would work? Like, you'd be able to get your kids off the bus at 3:00. You'd be able to make dinner, and obviously not in our careers, what we do as physicians, but but if you look at it in medicine, how we're doing telehealth. I mean, if you had told me 3 years ago I was going to be seeing patients through a computer, I would have laughed. So there, I think there are options for, work for employers to make it safe. And, you know, if that's looking at maybe people adjust, that you have, alternating days where there's going to be less people in the office. I think we really have to revisit those things, and just so you can have that social distancing. So maybe you don't have all 25 employees, in one day. You do, your A and B days, just like, my kids do in high school, Monday, Wednesday, Friday, Tuesday, Thursday, or, you have one joint meeting. And, I think we have all seen how Zoom has been working pretty well. I mean, obviously, that in-person interaction is needed, but I really think there's definitely a way for employers to make it safe, and then just to really kind of think outside the box. I mean, I think the days of putting 7,000 people in an office building in these larger cities, I think that's going to change.
Absolutely.
Do you want me to touch on screen time real quick, or?
Yes, that would be great.
Okay, I'll be quick. So, screen time, that is one thing that we actually, need to be worried about, because now we're staring at a screen all the time, and kids are on screens and computers more and more. So get blue light blocking glasses. Also make sure you're stretching, because we're all hunched over. We're not walking to talk to people. Do some yoga stretch, open up that chest. Our chest, we're all going to end up with like hunchbacks or kyphosis. So, make sure you're taking care of that. And really the eye strain, you need blue light blocking glasses. There was a study showing computer eye strain leads to macular degeneration, which is basically old age, blindness. So just wanted to touch on that too. So we got to protect our bodies and our eyes while we're staring at the computer all the time.
Thank you so much. Absolutely.